people with me this morning to continue with our kind of weekly update to hopefully keep you informed and these people will be able to answer some of your questions that we have. Again, we want to be as prepared as we can without panicking anyone. And so with that, I'd like to introduce the people that are going to be speaking this morning. We have Colleen Hedrick from Emergency Government. We have Norma Toombs from Aspirus, Patty Krug, our county nurse, and again, myself. With that, I just have a few comments this morning. I'm going to turn it over to these people. First, on the Safer at Home order issued by the governor and our upcoming election are two things that have been, many people have had questions on. Then I'm going to ask Patty to speak on the travel advisory at the end of our session today. First of all, the Safer at Home order, I want to thank all of our citizens, city and county, for following the governor's recommendations and mandates of the past couple of weeks. I realize it's been a stressful time for all of us. The weekend is here again, so please continue to be safe and healthy by following the Safer at Home order. Secondly, the city continues to encourage early voting. We now have 457 people, as of this morning, who have voted early. Our early voting will continue through next Friday, April 3rd. I have moved my office to the back of City Hall, so we have 2 individual rooms for voters in the lobby. We are trying to make it as easy as possible for our voters, so if you can, please take advantage of this early voting Monday through Friday of next week, 8 to 4:30. And again, together we are stronger. With that, I'm going to turn it over to our first speaker, which is Colleen.
Thank you. Each county in the state has its own emergency management agency to help communities prepare for disasters and emergencies, such as what Taylor County is dealing with at this time. Taylor County Emergency Management works hand in hand with the Taylor County Health Department, along with our other county departments and community partners such as Aspirus throughout the year, reviewing our emergency plans to help both businesses and community members to better plan and prepare for events such as this. I work with local community leaders on ensuring that they are receiving the necessary guidance for potential reimbursement through FEMA. I maintain close contact with our law enforcement, fire departments, and EMS to determine their current capabilities as well as potential needs they may have as we deal with these ever-changing challenges to ensure they remain safe as they continue their duties to serve the residents of Taylor County.
Thank you, Colleen.
You're welcome.
Next we'll have Norma.
Thank you. Aspirus Medford Hospital and clinics are prepared to meet the needs of the communities we serve. Much has changed across our system to ensure we are continuing to keep the community healthy and prevent the spread of infection. We've implemented visitor restrictions in our hospitals and long-term care settings. Employees and patients are screened prior to entering the facilities. If anyone screens positive for symptoms that may correlate with COVID-19, they are given a mask, asked to return to their vehicles to call the COVID hotline for direction. The number for the COVID hotline is 1-844-568-0701. It is operational Monday through Friday, 7 a.m. to 7 p.m., and Saturday and Sunday from 8 to 5. Symptoms of COVID-19 include fever, new cough, sore throat, and difficulty breathing. If you have concerns about symptoms and the hotline is not open, contact our number at Aspirus at 715-748-8100. We do encourage you to use the hotline first, as you will be speaking to a trained professional who can guide you. The state of Wisconsin follows CDC guidelines for prioritization of testing. Our tent will become operational again for testing once the state determines that more testing can be completed. Thank you.
Thank you, Norma. And now we'll turn to Patty Krug, our county nurse.
Good morning, everybody. As of right now, at 10:35 a.m. on this Friday, we have no positive cases in Taylor County. We do have people who have been tested, but again, we have no positive cases in Taylor County. As Norma indicated, there are testing requirements that have been set by the CDC guidelines, which are being followed through the state of Wisconsin, which Aspirus, Marshfield, and all of our healthcare providers continue to follow. I understand it is difficult to, in your mind, to try to figure out why am I not getting tested. Again, those tests are being prioritized, and please have patience with all related to this. Remember, protection is our best method that we can use for our community. Don't go to work if you're sick. Cover your cough and sneeze. Wash your hands and remember to social distance. Governor Evers' orders, Safer at Home, was instituted this week. We understand that because of some of those orders, there are hardships and difficulties that all of you are facing, just the same as we are at this table face along with you. His orders are based on federal guidelines that were instituted at a national level. He did not do this on his own. He is following the federal guidelines. The travel advisory, some of you have known, that we published as of yesterday through the health department, was on the recommendation of the Wisconsin Economic Development Corporation. And again, to protect the health of our community. It doesn't mean that you can't travel here for work or to go home. It just means that if you're coming from an area that has community spread and you're coming here, we want you to self-isolate in your home, find a way to get groceries to you, but we would prefer that you are not out in the community if at all possible, and find alternate methods. The governor, with the travel advisory in his orders, determines, if you look at the order, it will say who can and can't travel. So again, essential travel. Businesses. I know some of you have not been pleased with the choices. Some of you may not have been pleased with when we requested that you close your business. But remember, this is a great opportunity if you haven't started a business plan. Work with the chamber, call them, ask them, what can I do as a business plan? Learn from these lessons. Maybe you've never thought about doing an internet business. Now is your time to look at that. It is a difficult time. Choices have to be made. We want to social distance. If you feel that you are an essential business, again, the governor has options for you. Go to the Wisconsin Economic Development Corporation. There is a form that you can fill in to say why you feel you are an essential business. Get that information, provide it to the health department if we recommended that you did not meet the requirement, and provide us that written documentation that the WEDC says you are an essential service. We've heard much from people about factories. Why are they going to work? Again, some of us are thankful that we have jobs to go to, but yet we're still terrified to be in those same jobs. Again, we understand, but businesses are taking the precautions as per their business plan. Again, these businesses might be related to construction, they might be due to food processing, and again, we need to continue, and it is a scary time. We understand that, but again, we want those companies who are producing food to be able to get those to our grocery stores. We want those companies that are construction. Again, we want, you have a new house, there's a building, we need apartments, we're short of housing. That's why they're operating. Grocery stores, again, they're getting groceries. Do not hoard groceries, do not empty the shelves, because that means your neighbor, your family, and friends are not getting those same groceries. Think about others in the community who need those groceries just as much as you do. Again, this is a respiratory illness, just as influenza is. We understand the publicity, it's a scary time. This virus, again, has been noted that people die from it, just as they do from influenza or any other diseases. We are learning the same as you. Some mistakes will be made along the way, but again, those are lessons learned as a part of this. We will learn from our experiences just like you will. But we need to learn from past experience and those who are currently experiencing the number of cases such as New York. These are the lessons learned with the Spanish flu of 1918, as we learn with all pandemics. We understand your fears and your concerns because all of us deal with this on a daily basis, not surrounding coronavirus. It might be a cancer, it might be a child, it might be a parent who struggles. We all have fears and concerns, but they might be different issues, and we understand that. We all play a role in protecting the health of our public, of our community, and our members. I leave you with a message that someone sent to me. Viruses are contagious, but so is panic, fear, hysteria, calm, grace, empathy, love, and kindness. You choose which one you plan to spread. I want to thank all of you again for your continued support and the efforts that you do to protect the health of our community, Taylor County. Thank you.
Thank you, Patty. And I also want to thank our professional speakers this morning. It's been from the start our goal here at the city and the county to keep our people informed and educated on what's going on. The worst thing is when people is the unknown. I think one of the things about this virus is if we could say in 3 weeks we have to put up with all this stuff and then everything's going to be fine, I think that would take a lot of the anxiety and the fear out of the thing. Unfortunately, I think one of the doctors on our networks once said, the virus, we have to go by the virus's timeline, not by anybody else.